Welcome to another question and answer session. A 52 years old man developed septic shock following the Hartmann procedure for perforated diverticular disease. He is started on adrenaline infusion. So adrenaline, which is a sympathetic agent, which of the following is the least likely occurs? That means which will not occur. That means which will not occur. Here the options are the peripheral vasoconstriction, coronary artery vasospasm, gluconeogenesis, lipolysis, and tachycardia. So let's see the adrenal gland. And this adrenal gland, what is do? It do in emergency situation. It acts on emergency situation, that you can fight or you can flight. That means where or go. Let's see the adrenaline. It is fight or flight response. It is the fight or flight response. And the catecholamines, which is phenylalanine and tyrosine. It is a neurotransmitter and hormone, and it is released by the adrenal gland. So the adrenaline, it is released from the adrenal gland, and it affects on larger group of receptor, which is the alpha 1, alpha 2, beta 1 and beta 2. It acts on muscle by acting the beta 2 receptor of the muscle, and it is responsible for vasodilation in the muscle, and it acts an emergency condition. So emergency condition, the muscle of the hand and foot, they are very necessary for acting more. For this condition, vasodilation occurred, and more oxygen goes to the hand and foot, and more glucose and other food material goes due to vasodilation, and increased cardiac output and total peripheral resistance. So this is also important, because cardiac output increases and more oxygen goes to the desired organ or area. Vasoconstriction of the skin and kidney, causing narrow pulse pressure. So vasoconstriction occurs in the skin and also kidney, also gastrointestinal tract, because we need more oxygen, more blood in the heavy acting areas, such as the hand, such as the foot, heart, lungs, brain, this area. For this condition, where there is less food required, in this area vasoconstriction occur. And what are the actions? It inhibit insulin secretion from the pancreas, so passively it increase the glucose level. Then stimulate glycogenolysis in the liver and muscle, also increase the glucose level. Stimulate glycolysis in the muscle, it also increase the glucose level. And when it acts by stimulating the beta receptor, it stimulates glucagon secretion from the pancreas, stimulates ACTH, that means adrenocorticotropic hormone, and stimulate lipolysis by the adipose tissue. That means it is the emergency situation. In emergency situation, the body want to preserve all type of the metabolic own product of carbohydrate, protein and fat, such as the glucose, amino acid, fatty acid and other materials also. And its cardiac effects is depend on the beta 1 receptor, and it increases the heart rate. On the other hand, coronary artery, there is beta 2 receptor, and this beta 2 receptor is responsible for the vasodilation. Actually, in coronary artery, there is no changes of the blood vessel diameter. Actually, the blood vessel diameter of the coronary area and in the brain, they are somewhat water regulated. So which will least occur in case of adrenaline infusion? It is the coronary artery vasospasm. It is not related to the adrenaline infusion, but peripheral vasoconstriction occurs. That means the skin and gastrointestinal tract. Gluconeogenesis for glucose increase, lipolysis for the lipid content, which is the fatty acid increase in the blood, and tachycardia, that means increase heart rate. So only false option here, the coronary artery vasoconstriction.